Well, it was announced that Oxford has begun human trials of the vaccine. That's what we've been talking about now for a while, is we need testing, but then past that, we need a vaccine. So they have started this human trials that will be administered to 510 healthy volunteers between the ages of 18 and 55, and researchers there have said it has an 80% chance of being effective, and then very optimistic that it could be made wide for public use by this September. So what are your thoughts?
Yes, I've been also very interested in this vaccine development enterprise. There are over 70 trials ongoing in the world, and some are earlier than others. There's about half a dozen of them now are entered the clinical phase on the trying out on the healthy human subject for safety. And I do believe, given the nature and how widely the COVID-19 has spread, vaccine might be end of the day will be our savior to resume normal everything, life and business. And here's my assessment. Among the dozens of laboratories and companies who are racing to come out with a vaccine for coronavirus, I'm confident at least half a dozen, if not more, will be successful. So it means we will have the solution. And that probably as early as the later part of the summer, early fall, we will have early clinical data to suggest which vaccines looks promising or likely to work. So that's the good news part. Unfortunately, there is a catch. The catch is that when we come up with this, we call it a vaccine candidate. Everybody wants it. Everybody in the United States wants it. Everybody in the world wants it. Never in the world we ever have to produce so much vaccine in such a short time. We don't have manufacturing facilities sitting idle, ready to make billions of dosage at this moment. And the scaling up those large-scale manufacturing plant actually takes a lot of time, effort, and planning, which is something some of the people are looking into how to do it, how to prepare for the success. But at the moment, we'd be lucky, say by September, we have a successful candidate. We might make a few million dosage, but we need quantity literally in the billions. So which might mean there could be a long lag between most of the people, the vaccine becoming declared successful to the time people can get it.
I'm sure there will be a lot of companies that will try and step up to fill that void, but the question will be how many companies, how many around the world will be able to produce what is needed worldwide.
Correct. And here's another catch, is to set up a large volume vaccine manufacturing facility. It's not just the cost. It will cost minimum, say, $10–20 million to set up a plant that can do, say, 20, 30, 50 million dosage. But it takes time because those are special equipments and instruments. They have to meet regulatory standards. They need to be inspected by FDAs in the United States. And they need actually specialized personnel to operate them. So it's not one of those things we can just, sort of make do. And because this is something we inject to healthy people. And the last thing we want to happen is to have unintended consequence or complication related to the vaccine. So there is the cost, time, and skills and experience as to put together. And also the different vaccine right now under development, they are different constructs and they require different platforms. So let's say I'm looking forward saying, I want to build something, anticipating something will be successful, but I don't know right now which horse is going to win, because you need to build a specific facility for the specific type of horse, which is the best way I can describe it. So there's going to be always going to be a lag. So that's the story related to the vaccine. But the good news is that knowing the nature of this virus and the experience we have with coronavirus before, I'm fairly confident. I will give definitely 80+% chance or more higher before end of the year. And one or more companies will have a vaccine that everybody view is a good, successful candidate.
And then finally, public health officials have been predicting a pandemic like the 1918 influenza epidemic for years. Bill Gates has recently written that after we take care of the U.S., our country should focus on helping Africa and South Asia get ready. And you are already working in Africa. So what would that look like?
It's basically the ability to detect the pandemic early, and which means surveillance systems, laboratories capable of testing for different type of disease, virus, or bacteria, and able to send out teams or investigate in the field when there's a suspect condition, and then also set up contingency plan to respond how to control. Because a good scenario is that, because we know for sure almost every decade there's going to be some new pathogens is going to show up. That's just the nature of the world. We had the Zika a few years back. We had, the sort of avian flu, the H5N1 10 years back, H1N1. So there's always going to be something. And the question is how successfully we can stop the pathogen early on the track. And the way to do that is to find them early and put them out early. And that requires capacity, laboratory, epidemiological capacities, as well as response capacity. I think in this case, this COVID-19, China actually detected in late December. And they probably had a lag about 7 to 10 days before they had fully responded when they detected. Even that 7 to 10 days, in retrospect, turned out was faithful, because this is what they call it exponential growth. Means you start out with one case, doesn't look very much, but if you let it go for 1 week, it might become 10,000 cases. If you go for 1 month, it can become more than a few million cases. So countries, and we're in the world together. If we want to protect Americans, we don't know which the next virus is going to pop up. It could be Asia, it could be Africa. So helping all those countries having this ability to respond, to detect, is good for everybody, good for us. So that is why those are important investments that we need to make.
Thank you, Dr. Yip, for joining me. I really appreciate your time, and we're going to leave our viewers with the words of Bill Gates: there's no time to waste.
Thank you very much.